to make the best of this, I hope. I love it. Let me tell you that we'll get started, sweet Lynn, and we'll let everybody pop on. I'm afraid Liz is the host, so that may mean things have to adjust a little bit, but we'll do it if we can. So Lynn, I looked you up on LinkedIn today.
Oh, I haven't even updated that stuff in like ages.
So, but it says you've been with the health department for 6 years.
Yeah, this is true.
Over 5. But before that, 31 years. Wow.
So now if you add it up, you know how old.
Let's see, and then you take away, you add, and then you take away. That's it.
Yeah.
So you are the director of outreach,
clinical and outreach divisions here at the health department.
Fantastic. Tell me what that means.
That means I have the home visitation for our at-risk families in part of my division. I have our health promotions, so that is our stop smoking programs, our weight down programs, and our diabetes prevention programs. And then I have all things communicable diseases. So that means epidemiology, that means sexually transmitted infections, and it means all things COVID. So yeah, that's kind of my life right now. Plus I am the fetal infant mortality review coordinator and the child fatality review coordinator, and then help out with the opioid review as well. And I think you're muted, Denise.
Yeah, well, they try. That's amazing. I can't imagine how full your plate is, because it certainly sounds that way.
It's kind of full, but it's okay. And right now I am the liaison in between the health department and long-term care.
Wow.
So all of our nursing homes that we're supporting, and we do that on Tuesdays as well as an echo session for all of them, so they stay up on best practice.
So is that due to COVID?
Yes,
Lynn, is that where that's coming from? It's all COVID related.
On COVID, just being a support. There's a lot of new regulations that are constantly coming out, and just being a liaison. So when there's questions or they run low on PPE, if it's like their needs are endless. So in between testing and Bionex testing and being able to support to talk through when outbreaks happen within a facility, just being a support to them.
That is amazing. Well, bring us up to date on things, and then we're going to pepper you with questions.
Okay. So I don't know if many of you have been able to go to the Indiana Department of Health website, but that is a wealth of knowledge there. And the great thing is you can look at the map that is updated every Wednesday, and we are blue. And we have been blue for the last week, that we think this week is going to be our second week. And so things are really, really doing well. Do I think it's because vaccine? I believe it's because vaccine. So let me catch you guys kind of up on the Indiana, and then we'll go to locally. So far Indiana has vaccinated about 10% of our population. And I'll get to locally here a little bit more. And we fall in about, I think, the 17th highest of the states for getting our per capita. I mean, you can't compare California to us. It's the amount of the percentage of residents that we've done. And so as a whole, we're doing really well. We so far in Indiana have received 2.2 million doses here in Indiana. And we have 444 vaccination sites across the state. And those are hospitals, those are health departments, those are CVS's and Walgreens and Myers, and a whole multitude is our federally qualified clinics like Echo Clinic here in town. Echo has not received their first vaccine shipment as well yet. There have been 1.1 million first doses given and 725,000 fully vaccinated, with 2.3 million appointments scheduled in the Zotec system in which we schedule everybody. So it's getting there. The Johnson & Johnson vaccine is the latest one to come out. I know that sometimes people have questions when they first come out, And there was questions, you've probably heard in the media and stuff, do we want Johnson and Johnson? You want any vaccine you can get your hands on. There is it's 77% effective for severe or critical infection, and 85 effective, occurring at least 28 days after vaccination. So it's 85% effective. The big thing is to keep people out of hospitals. If they have a few sniffles or they have a little cough, we can live with that. We have that all the time, but this is keeping people out of hospitals. Its side effects are a little bit less because there's not that double dosage and actually boosting up that immune response, which is a good thing. And some people just like the idea of one shot. This really is helpful for the health department because there are certain populations in which we may only have one shot at getting them. And that includes our homeless population. And I see Tim down there nodding. It is our incarcerated population. It is our marginalized communities and our disparate rates, including some populations, including the Marshallese, that we may only have one shot at getting. So we're excited about that. And as far as, like I said, side effects, 1 to 2 days. If it's a new symptom after 1 or 2 days after vaccination, it's not related to the vaccination. Okay, guys. And we hear about things popping up a week or two later. That's not related to vaccine. We just know that happens pretty often, and it does happen with the Moderna and the Pfizer vaccine, because not so much with that first dose. First dose is about 6% have side effects. Second dose is around 16. You do hear about it because people that don't have reactions don't usually talk about it, but people that do have reactions talk about it a lot. So again, just getting that in there. One of the other things, and I'm looking at all my notes, there's now a resource in which vaccinated people can go and get their certificate to say they're vaccinated. And I will get that to Denise, and she can get that all out to everybody, besides your little card that you get when you are vaccinated. But this is an opportunity, to have that. Again, the CDC just came out with some new recommendations about people that are fully vaccinated, which is a great thing. It doesn't really correlate to businesses yet, long-term, to healthcare facilities, but it does talk about in your home that people that are fully vaccinated can be indoors without masks, or without physical distancing, as long as everybody's vaccinated. They can also visit indoors with unvaccinated people from a single household. Again, this is a single household, without mask or physical distancing, if that unvaccinated people are a low risk for disease. The great thing is vaccinated folks do not have to quarantine after their 14 days after their vaccine. So whether they're in your business or where they're ever, they don't have to stay home if they've been exposed, and they're feeling really confident about that. Fully vaccinated, guys, just as a reminder, is 2 weeks after your vaccine, whether that is Pfizer, whether that's Moderna, or whether that's the Johnson and Johnson product. When we ran the numbers last Friday, if you took everybody under the age of 18 out of the picture, because we're not vaccinating those folks, except a few folks with Pfizer vaccine can actually go down to 16. But it is few that are vaccinated in between that 16 and 18-year-old, and they work mostly, be surprised, in long-term care facilities as CNAs and pass and trays and working in dietary and those kind of things. But when you took everyone 18 years and under and looked, we have about 25% of our population in Vanderburgh County vaccinated, which is this is good news. Yeah. So that is. Now, I want to talk a little bit about our disparate populations, because that's really important to the health department, and I hope to everyone here in our community. So as far as the Black population, of the vaccines that we've given in those areas, 50 and above, we have about 4.4% of the vaccines that's went to the Black population. Other race, which can be our multicultural or our Marshallese, it can, it's a large group, is about 1%. Our and then a lot of our Latinos actually put down other race, even though their skin may be white, their skin may be black. They see themselves as another race. The Indiana Department of Health sees it as a ethnicity versus a race, which can be really confusing and muddy things up a little bit. But that's a different story for a different day. Our Asian population is less than 1. And our unknown or unwilling to disclose is 4. That leaves 89% of our first doses given to the white population, which I cannot wait until our next census comes out. So all I have is data from 10 years ago saying our population was 87% white. Working here at the health department, looking at birth certificates, doing my work in child fatality, doing my work, period here, I know that is much higher, and more people are identifying as multiracial and Black as both. So I really think that those numbers are underrepresented. And we know that people of color are not embracing that as much. But I will say that we, as the health department, are in constant talks with our disparate populations. Just this weekend, coming up at Memorial Baptist, there is an opportunity in between Ascension St. Vincent. I have to think about that name every time it comes out of my mouth. Ascension St. Vincent is going to work with Reverend Brooks and Arlinda Payne to make sure that they've got 100 doses to get out, and working really closely with them. We're really excited. I will say the Department of Health has not allocated Vanderburgh County the way they have allocated other counties. I will say that it's kind of just went like everybody gets 600 doses a week, whether it's Warwick County, Gibson County, Posey County, which just really sucks for us because they don't have the disparate populations that we have. They don't have the homeless folks that we have. They don't have a jail, which is 500 folks. So we're a little bit on the frustrated side, I'm not going to lie, and working with my leadership and leadership at the state level to get them to understand that we need doses, especially of Johnson & Johnson. This is what we need. We may only have one shot, and we want to get this done. We received our first shipment of Johnson & Johnson on Monday. We do have plans, and Timothy, we're going to be calling you. But it is not, we asked for 2,000 doses and we got 200. So again, we're going to split that up with being our homebound, our homeless. We do have a plan. And so we're going to start, we expect not to get another shipment of Johnson & Johnson until the end of the month, the first part of next month, which is very frustrating to us. You shouldn't have seen me on Friday. It was ugly because I found out I was only getting 200 doses and it did not go over well. And it's just frustration on my part because I know what I need to do for our disparate populations, and we're ready to go. Everything is ready to go. I just need vaccine. And I know these other counties got 200 doses. And they don't have the disparate populations that I need to address. But of course, once it's allocated to that county, they ain't letting go of it. So yeah. So we are currently working with the NCAACP with doing, this is our best shot. And actually we've had health department folks on that. So the NAACP, has asked us to be part of that, and their campaign is through trust, truth, and transparency. And this is our best shot. and they're really trying to get the information out there to the Black population of that we really need to get vaccinated. As far as disparate populations, the Black population has not done well with COVID because of their comorbidities, their ongoing stress within their own communities, and past stress. It's same way with the Marshallese population. So we are working with our Hispanic population as well. And Abraham has been working really closely with us along with some other leaders. And we will be doing what we call closed pods or points of distribution, like that we wanted to do with the homeless population. So it will be only available to those disparate populations unless somebody else signs up, but we won't advertise it to that effect. We'll make sure that when we go to, I think our plan for the Latinos is to actually do it there at the Latino Center in Washington Square Mall, so that we can go to their trusted place and to be able to do that. I just need vaccine. Same way with the Black population again, and we're working the health department. I've talked every Wednesday with both pharmacists, lead pharmacists at both hospitals, so that we all understand. And if state's not going to give it to us, we're going to find a way to get Pfizer out. And that's what they're doing with the Black churches. It's just that follow up, and do we lose people then before that 21 day? It's not ideal, but we're going to do what our community's got to do. And same way with I have a meeting tomorrow with Deaconess so that we can figure out what we can do next with working with them. Everybody sees again those disparate populations needing more. And we're actually with also looking for mentors or looking for trusted leadership within each disparate population, so that they can get that word out. Even looking to the Black barbershop to really putting it out there. Hey, I've gotten my shot. I understand this, and really giving them the materials so that they can make sure that everybody kind of understands. The only other thing is teachers is an ongoing problem, and we hear from them quite often. So their program now is coming down from the federal level. The only current federal place that a teacher under the age of 50 can go is the Walmart, locally is the Walmart on Burkhart. And I think there's about 5,000 teachers that fall into that. When I talk to EVSC leadership, with the age group of 50 and above, for everybody that works in EVSC, there's about 38% eligible with that. But then you've got over 60% of those that are going to fall in that younger age group. I do believe we'll open it up to 45 and above next week. Don't hold me to it, but that's my hopes after listening today with some of that information. So I've talked long and hard for 24 minutes. So I'm sure there's questions of what people
Absolutely.
know or want to know.
That was amazing, Lynn. Thank you for all of that information. You can throw your question into chat, or if you want to just pop up and ask her, do it. We're flexible here. Anybody got a question?
Hi, Lynn. It's Amy.
Yeah. Hey, Amy.
We used to work together forever ago. So I just want to say, first of all, thank you to you and the staff at the health department. I know that you are doing everything. You're working way overtime. So we're thankful for that. And just kind of curious, when you talked about trying to get to some of the disparate populations, and I'm excited about the opportunity at Memorial that's coming up.
Right.
Are you planning any other vaccine clinics similar to that at this point, or?
We're going to be in Greater St. James. And then our next thing is, and we've got to, we're in talks with the housing authority. So we feel in our hearts that people that are in, the towers in Buckner Tower and Kennedy Tower, we know that their resources are limited. As far as we know that there's all kinds of folks that are 80 plus that don't have computers, that don't know how to sign up, that won't be on calls. So we're trying to think outside the box, and could we, you know, since those guys are already there, that would be an ideal place to take Pfizer, because we know that there's going to be there in 21 days, or to take Moderna and go back in 28 days. So again, this is this giant jigsaw puzzle in which we're trying to figure out the best bang for our buck. But right now, we are kind of held to the 600 doses that we get weekly for our clinic that are already built out and already spoken for in that Zotec system. And how can we get extra doses either from our hospitals or begging, you know, for Southern Indiana to be represented at the state level. They had these big drive-up clinics that they did over the weekend, and two of them are in Northern Indiana, and one of them was in Marion County. So again, getting them to recognize Evansville down here is not always the easiest thing to do.
Thank you. Is there anything we can do to help advocate for that for you?
Yeah, I'd love it if you complain about it at the state level too. I mean, I don't know what to do to get Vanderburgh County on the map. If you guys can see my frustration level when I find out about my weekly allocations, trust me, nobody likes it when I find out around here.
Tell me how to do that, Lynn. How do I get?
My assumption is just to contact the Indiana Department of Health and how you want to see an increased allocation to address disparities in Vanderburgh County.
Excellent. Thank you. I'll try and get that information too, Lynn, and get it out to everybody.
And I saw Tim unmute himself. I'm sure he's got questions about the homeless.
Go
And that's
Tim.
fine.
Well, first of all, I want to thank Lynn. You know, the Commission on Homelessness couldn't ask for better partners than the Vanderburgh County Health Department. And you and Joe have been amazing. So thank you for all of your support. So brief story, about a week ago, we had a significant outbreak at United Caring Services Men's Night Shelter. And we had a number of gentlemen who were close to each other and had become infected and COVID positive. And it was Lynn who offered up the use of the rapid testing. And Lynn, there's a scientific name for that, but Lynn and her staff trained.
But that's okay.
Trained our self-isolation team on how to use that test, and we were able to quickly get people tested and into isolation. So thank you so much for your assistance with that. And then just for the rest of you, the other thing that we're working on is lining up clinics at shelters and homeless service agencies so that we can get that large homeless population in Evansville and, you know, get them potentially the Johnson & Johnson vaccine so that they only have to get vaccinated once. Fingers crossed.
And Tim, I just wanted to let you know that we would love for you to identify those individuals greater than 50, and let's just start. You know, we've got about 100 doses that we feel like that we can get into some arms. So if you and your team can start identifying those individuals over 50, let's just start, because there's no sense in waiting now until we get several hundred doses. We got to move.
Sounds good.
Okay.
Thanks for your help, Lynn.
So how can Ellie help you too?
You know, again, being an advocate for Southern Indiana and for Vanderburgh County and specifically, and the reason, and I hate to be Vanderburgh County specific, but when you look at the disparate populations across these other counties, they're not there.
Yeah. Sure.
And so I have to be an advocate, you know, when we're looking at jails that are 80 and we're looking at a jail that's 500.
Oh, yeah.
We're looking for homeless population that's almost, now granted, you're going to have your couch surfers and things like that, but you're not going to have these group settings like what Timothy's talking about, you
That's
know,
right.
advocating, then also, you know, like our group homes. I mean, we have these disparate populations, these communal living situations, like, you know, even including Albion, you know, that these communal situations that don't happen in other counties because we're the big county and they all come to us.
Yeah.
But yet we're not seeing an allocation that is bigger to address these individuals, and it's making us crazy.
Yeah. We can do that. We can do that. What about, oh, Candace just asked, are you asking the same question I am? Yeah. Do you have enough personnel?
You know what? We do have on our website, we do have volunteer lists that you can go on to and do. Yeah, right now we do. If we can get this increased allocation and we can get that going, yeah, maybe we would, but we would utilize that list just because we have to vet those folks and making sure that you know, they're holding current licensing for the nurses that are vaccinators, but then also, and then like just also working with individuals like Timothy and his group, they will volunteer, you know, like we'll give them the specifics about thing and then we'll just come in and vaccinate. You know,
Yeah.
we'll bring the team to vaccinate and the team to transport the vaccine and that kind of thing. Then we just need support staff to get that going. So
So,
again,
so
I
you
can
could
say,
use some volunteers.
yeah, and
Do
you
that
can
kind of
go
stuff.
to our website, the Vanderburgh County Health Department website. There's a link that actually takes you right to the volunteer page.
Do you put that out on Facebook, Lynn? Is that out on your
We do.
social media?
I will tell you, we felt kind of bad because our hands are we're asking for volunteers, but we can't utilize them right now because I don't have vaccine. Then
Right.
people lose interest and they're like, oh, do I? So we've kind of held off on that again. It
Okay.
went out. We have a good portion of people on it. Now we need to wait for vaccine and then ask for more help. Does that make
Okay.
sense?
Yeah, makes perfect sense. So Ellie is so there for you. Like we will
Yeah.
push it out on our social media when you need
Sure.
it. Hey, Amy has supplied the contact
I see
email
that.
for everybody. So that's your way to advocate, my friends. We can make a difference that way. That's fantastic. Thank you for that, Amy. I appreciate you. Who else has a question? I don't want to knock anybody off anytime soon. Anybody got a thought? Timothy.
I'll just make a quick appeal. If you're interested in helping to vaccinate our homeless shelter clients, we would love some volunteer assistance. So I'm going to put my contact info in the chat. If you can help us with that process, that would be awesome. And spread the word that we're going to need volunteers to assist.
Are you going to put that out on your social media, Timothy?
Yes. Yeah, we'll do that too. Absolutely.
So we'll pick it up and we'll push it out on Ellie social media. Is that okay? Yeah. Okay, great. You bet. You bet. Okay. Anybody else got a thought?
One of the other things that we did last week too was support the OVC basketball tournament so that they could have a safe tournament. In our partnership with Deaconess, we tested 16 teams and all of their referees as well. And
Wow.
luckily we had a very safe tournament. There was one kid that was symptomatic and one ref that was symptomatic, neither one of them having positive PCRs, and everything went off without a hitch.
Wow.
So it can be done.
That is awesome. That is fantastic. Good news. And you know the vaccine's making a difference.
Well, none of these folks were vaccinated. So just being able to do PCRs and to keep your bubble very small, everybody wanted to play ball.
Yeah.
And so it worked.
That's great. That is great. And Lynn, I know that we were working with the Black Brown communities to get the radio spots on WEOA.
Mhm.
That was so fun.
Yeah,
We started we started getting all of those things coming in. Sarita did all the editing for us and got them to Ed, and it was fantastic. So for everybody who doesn't know, we reached out to the Black Brown leadership and asked them to do quick 15-second, like, I got my COVID vaccine, you should too, kind of radio spots. And then they're being featured 24/7, I think, on WEOA 98.5. So that was really great. And you feel, did you tell me that you felt like that message was going out pretty well?
I think it's getting there. It's getting there, and with time, and that trusted leadership saying, get your vaccine, it's okay, you know, we got to trust this, and there's a long-standing history of untrust in the Black population, and then also with our undocumented Latino population, and making sure that they understand they do not have to be a documented citizen by any means to get a vaccine.
Fantastic. We've got Sarita has helped us connect to the Latinx community, and actually Dr. Lopez, Dr. Gladys Lopez, connected her to some of the medical students at the IU school, and they're going to do some spots for us. So that's kind of neat. It's neat to watch everybody collaborate.
They've done two, and they have sent messages in Spanish and in English.
Yeah.
So we can like
translate. Yeah.
Sure.
The message out.
And we're very blessed here at the Vanderburgh County Health Department to have 4 individuals that speak Spanish from different backgrounds.
Yeah.
We have, you know, Mexican American, we have Colombian, we have Spaniards. So it does work. You know, there may be a little bit difference, but usually we can get by pretty darn good to be able to get people to sign up for vaccine, or if they show up to the clinic, to make sure that they can translate for them.
That's fantastic. That's amazing. Anybody else want to chime in, get some info? I get my first shot on Thursday.
Good for you.
Lynn got hers last week, so we're getting excited. My mom and dad had theirs by God's grace. They hugged all of us for the first time in a year last week, so it was great. Yeah. Okay, I think that you everybody make sure you take a look at the chat and pick up the links there. Okay, and stay tuned. We will let you know how you can help and get connected for any volunteer effort. And besides that, let's give the Vanderburgh County Health Department a big hurrah. Thank you, sweet Lynn. You're amazing. Thank you for the effort.
I am putting my email address in the link. So if somebody's watching this later on, I think you're recording it.
We sure are.
Or if you have, I can't always pick up, but I'll get back to you. Okay.
You do.
So that way, if anybody, and Tim, I've given you your kind of assignment then, so that you can work on a few things to get stuff going. And I'll look forward to hearing from you and your group on at least let's get these 50 plus year olds and get them vaccinated with some Johnson & Johnson.
That's awesome. Let me tell you one last thing. We want to get everybody vaccinated. Hooray. Hey, celebration of leadership, if you can believe this, is already next Thursday. It's March 18th on WNIN at 7:00. And then it'll re-air again on Sunday, the 21st at 5:30. We will also be live streaming on Facebook at the same time on Thursday night at 7 p.m. So have a watch party.
Okay, hey, Lynn, we probably will here at the health department. Is there anything as a nominee that we should be doing? Do we need to make sure that somebody's able to put something in the chat or to do anything?
What? Tell me what you mean.
I don't know. Is there any responsibility as far as the nominees that we need to be aware of?
No, you need to watch. That is your highest calling. Your highest calling is to watch.
We got
and then
that.
have a party. Yeah, it's going to be amazing. It's been an amazing year, and we're going to top it off here with some good news. Celebrate our servant leaders.
You can change your profile picture to have the little frame on it.
Oh,
Timothy and I
okay.
did it.
Okay.
What?
Yes, we did today.
Yes.
Elizabeth created a frame for your Facebook photo
Where am I? Where have I
for
been?
COL. Well, go get it.
I'm out of here, people.
All of you
good,
should.
Sarita. Okay.
Yeah, all the cool people have it. So
I know. Oh,
Okay, well, now I'm gonna have to work on this.
I know.
I
Sarita, did
posted it on the Ellie page. So
Okay.
excellent. So we'll all jump on Facebook and do that.
mhm.
Okay.
We'll get that.
My computer's
that.
working now.
Yeah. Now that's all done. That's
I've
fantastic.
heard the whole thing. I just couldn't use my video.
That's it.
We'll
Well, we're
jump
glad
on
to
and
see
do
you,
that.
Elizabeth. All right, everybody. Anything else? If not, don't forget COL. And we love you. Thanks for making a difference everywhere you are, everything you do. Okay. Thanks so much, Lynn. Blessings on you. Everybody say a prayer. That's for sure. For that health department.
Yeah.
Bring in those vaccines.
We're trying. We're
Yeah,
trying.
well, we'll help. We'll help. Thank you so much, friend.
Bye now.
Bye. Bye, everybody. Glad to see you.